Let's talk about the thought process that we use when we're dealing with a post-op labral hip repair when we're starting to go into a lateral lunge sequence. So there's three ways that we could do this. We could go just lateral lunge with no resistance. We could go lateral lunge with a band resistance. Now take a look at what is happening here. As she actively abducts and has to push against the resistance, she's loading and using the lateral hip structures to contract before she gets into the lunge, so she's already preloaded. So if she takes the band off and we do a kettlebell, so now there's still muscle activity going on to pull her into abduction, but less because she doesn't have resistance. So there's less pre-recruitment, less preload. So when she goes down into her lunge now we have different muscle recruitment occurring. So does that mean that this exercise is not as good as the other exercise, or that this is a bad exercise? No, that just means that we chose one to start with. I like the first one, to preload the lateral hip structures post-op. Then we can go to this. So she's doing the exact same motion, but she's recruiting muscles in different sequences and differently as she's going through the exercise.